Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and right now we are speaking with Desi.
Hey, Desi, Dr. Marc Darrow, thank you so much for calling in, and I want to finish up with you and your knee. First of all, hang with me because I want to talk about generally what regenerative medicine is for this new group of listeners. And what we do is we inject the body with platelets from your blood or stem cells. And very, very simple procedure. You walk in, you get your injections, and you basically walk out. That's about it. So nothing difficult about it. You don't need anyone to drive you. You don't need sedation. You don't need to be in an operating room. You don't need anesthesia. It's easy. And we can do it anywhere on the physical body. I take care of necks, backs, knees, shoulders, fingers, elbows, you name it, doesn't matter, because the process is the same. All we're doing is regenerating tissue to grow. So where you have an injury or arthritis, we just regrow the tissue and rejuvenate you. So it's pretty simple. So Desi called in a couple minutes ago before the break, and she's had a couple months of what she called lightly feeling pain in the beginning. Now it's getting worse. And it's in the area she described as where her medial meniscus is. And sometimes if you want to find where that area is, it can either be in the middle, which is the medial meniscus, or the lateral, the outside of the knee, the lateral meniscus. You'll put your fingers down there, you'll feel a little dip. It's like a little crevice that goes all the way around the knee. And that's the medial meniscus. So I have that myself on both knees, and we can see it on an ultrasound. But I've injected mine, and I have no more pain. I will go out and play golf today. I will go running in the mountains today. It's gorgeous, and I like to get outdoors. So I've had pain in many, many parts of my body that I have injected. I'm all better. Will I have new areas someday? Yes, I'm sure I will, because I am a crazy athlete, and I'm repetitive. And Desi, I don't know if you're as bad as I am, but the main idea is stay away from surgery if you can help it. And Desi, you mentioned your left knee had an ACL rupture. I haven't had one ACL rupture that I've sent to a surgeon. Actually, that's not true. There was one who was the number one surfer on the planet. I didn't think he needed it, but I thought because he's dropping in on waves that are like 60 feet high, that I didn't want to be the one that had a problem when that knee gave out. Whether he had an ACL disruption or not, it could happen. But I get ACL ruptures all the time, and the first thing I do, I look with an ultrasound inside. I drain the blood out if there is blood, and we know there's blood. We don't know if there's blood when we look with the ultrasound. We have to pull it out and see what color it is. Most people with fluid in their knees or their shoulders don't have blood. It's just a nice yellow fluid, which is synovial fluid, which is hyaluronic acid, which makes no sense to me why doctors inject hyaluronic acid. You know, these different types of medicines they inject, because most people already have too much there already. These doctors don't use an ultrasound, and they don't inject with an ultrasound, so when they inject things, it's not even going to the right spot. So, Desi, do you have any more questions about this?
No, I think what I'm going to do is, I'm actually at the gym right now, is
Good.
go home and I can go online and maybe set something up to get in your office.
Yeah, or you can do that, or you can email me at www.jointrehab.com if you want to talk to me personally. But you can go to...
I actually subscribe to you, so I get stuff in my email from your
good.
Newsletters.
Wonderful, wonderful. But again, anybody can call. Great. Anybody can call the office at 800-300-9300, and there's people by the phone most of the time, and even during the show, you can call. Well, Desi, God bless you. I think, from what you're telling me, your knee should be super easy to fix. I don't ever give anybody any promises. There's no guarantees. But from what you're telling me, it's not a big deal.
Okay. Well, I really appreciate you taking my call and giving me your expertise advice. And I will, like I said, come in and or go online and see if I can't get in soon.
All right. God bless. Thank you so much, Desi. It's a pleasure.
Thank you, Desi. And would you like to go to Jeff?
I will. Jeff, hang there. I'm going to give the phone number so we can get more callers. The phone number to talk to me live right now, 866-870-5752. And I just want to mention that Dr. Thomas Grove is working with me now, taking over most of the injections. So he is amazing. He's trained like crazy in this type of procedure of regenerative medicine. He's been doing it for close to 15 years. And, what was that?
I don't know.
Anyway, Jeff, you have a shoulder problem. Tell me about it, will you please? This is Dr. Marc Darrow.
Yes, hi, doctor. Thank you. This has been pretty chronic for a while. I think I'm pretty safe to say it comes from a whole lot of baseball.
Okay.
And I had an MRI done a few years back. And the thing is, my day-to-day activities, it's perfectly fine. And certainly a reason I've never rushed into surgery for it. I only have pain when I physically throw the ball or if I serve in tennis.
Okay.
It's that action, and the pain is for like 5 to 10 seconds.
Yep.
And then it goes away.
Okay. So I had the same exact thing. Yeah, exactly the same. And I injected myself and healed it.
Wow. Okay.
Now, the cute part to all this is I was dumb before I started doing this type of medicine, because I was in line to be an orthopedic surgeon. I was training for it. And so what did I get done on my shoulder when I had that pain? Guess.
Well, you had surgery, that's for sure.
Yeah, I had surgery, and I woke up after the surgery. My arm was as swollen as a balloon, and I had a high fever. And I loved my surgeon, who was my boss. He was my professor. But things just don't always come out right, okay? And I'll tell you something else. I was in an ultrasound class about close to a month ago, and the instructor was showing me how to inject the wrist to block the median nerve. And guess what he did on my median nerve? Tell me. He tweaked it. He put the needle through the nerve, and I'm still having paresthesias, shooting pain down the hand. Yep. This guy's the expert. Does it under ultrasound guidance. We watched that needle together on the ultrasound screen.
Jeez.
I may have this the rest of my life. So I'm saying,
I've had multiple people say, "Oh, let's do some cortisone," and I'm like, "No, that just masks the pain for a short period of time."
Well, it masks it for a short period of time, but then it actually deteriorates the tissue. So long term, it gets worse. I get new patients in every day. I had steroids. It worked great, but it didn't last long. And then they're worse off. Right. So anyway, I had the same thing you did. Throwing in tennis serves was a killer. And I had the surgery that made me horrifically worse. And then 4 years after the surgery, I learned about regenerative medicine. And I experimented. I had experimented on my wrist. It got better. And then I experimented on my shoulder, injected it myself. Overnight, my misery was gone. I had full range of motion and no pain. So
wow.
I'm a believer in this stuff. I've done both my knees with stem cells, platelets. I've done my shoulders, elbows, my right wrist. Other people have done my neck and back. I've had my broken ribs done that wouldn't heal until this. So I'm a fan.
Sure. Okay. Okay. So are you saying you fixed your shoulder in one visit?
One visit to myself.
Right. Right. Okay.
I mean, the rest of the story is hysterical. I came home one night. It was during my residency at UCLA. And I came home one night, and I had my syringes with me. And my wife was watching TV lying in bed, and I jumped in bed with her, and I pulled out the syringe. She's a nurse. I pulled out the syringe, and I took my T-shirt off. And she goes, "What the X are you doing?" And I said, "I'm going to inject my shoulder." Worked on my wrist. And she was screaming at me, like, "Don't do it here." I did. And that's when this happened. I woke up the next morning completely healed. So life is very strange, right? And that was like God kissing me on the forehead going, "This is what you're going to do for your work the rest of your life instead of surgery and drugs and steroid shots and all that stuff that I was trained in."
Okay. Wow. And it never came back? The pain?
Oh, it came back. Sure, it came back. 12 years later, I re-injured it.
12 years. That's no.
Well, I re-injured it. It wasn't the same thing, but yeah, my shoulder hurt again.
Okay.
I'm an idiot. I'm just being honest, man. I'm an idiot when it comes to sports.
Oh, when I had the MRI done, the orthopedic surgeon, he looked at it and he goes, "Wait a minute, you said you still play?" I go, "Oh, yeah, sometimes 3 times a week." And he goes, "Well, what, do you pitch underhand or play first?" And I'm like, and he looks at it again when he says that. And I go, no. I said, I'm a lifelong shortstop. And he goes, "You must be in incredible pain when you throw." And I said, "Doc, I never said I was smart."
Yeah, but there's something more important even that you just said without knowing it, Jeff. When studies are done on people that have no pain, MRIs are done, okay, X-rays are done, guess what we find?
Tell me.
Tons of junk that surgeons would love to operate on.
Oh, love to.
I'm serious. If I had an MRI of my shoulder right now and I brought it to one of my surgeon buddies, they would go, "We got to operate on this right away. You've got 2 rotator cuff tears, your subscapularis is torn, your supraspinatus is torn, and the labrum around the humerus bone is torn. These need to be operated on." Well, guess what, Jeff? I have 0 pain in my shoulder. I will play golf today, and I'll probably lift weights later tonight.
Terrific.
I have 0 pain. 0, 0, 0.
Wow. Okay. Fair enough.
Have I injected my shoulder a bunch of times? You bet I have. I've injured it a few times.
Mm-hmm.
My right shoulder and my right wrist are my main sports deals, and my right knee. Both knees, running and whatnot, golf. I'm a ballistic golfer. Yeah. I'm 75 and I still hit the ball further than most of my buddies who are, more than half my age. I don't enjoy sports unless I'm ballistic. I'm just being honest. I just don't.
Right. I'm pretty much the same. So, yeah. Okay. Well, good. All right. Well, I have your office phone number.
I'm going to give it out again for everybody else who doesn't have it. That's 800-300-9300. And for those of you who want to call me live right now, the phone number is 866-870-5752. If you call in, we're going to give you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got over 250 scientific studies on how regenerative medicine of platelets and stem cells work, the science of it, and how surgery can really screw you up. And I am sorry, I have a lot of orthopedic surgeon friends. We fight like cats and dogs. And, it's like, I'm right. No, I'm right. And I don't know who's right, but I do know that my office is filled with people who have had failed orthopedic surgeries that have screwed them, made them much worse. If my work doesn't work on you, guess what? Big deal. You can always get a surgery. Make sense?
Makes sense.
All right, Jeff. Can't wait to meet you.
Thank you very much for your time.
All right. God bless you.
Thanks for your call, Jeff.
So Mark, we're going to get to you in just a second. This is Dr. Marc Darrow. I'm an MARC, and I think the guy calling in is an MARK, and we'll still get along pretty good, Mark. First of all, I haven't mentioned yet that we also inject the head to stimulate the follicles to produce hair that's not working too good. Sometimes people start thinning, and we also inject the face. It's called the vampire facelift, to regrow the collagen in the face to make people look younger. So, Mark, you've got a low back problem, and how long has that been bothering you?
Well, it's actually what it is, my brother. It's a difficult... I'm not going to get technical with you because, first of all, I don't know how. But
you can pretend.
I can tell you this. Yeah. My brother has been struggling with this thing, and I wish I knew. I mean, it has a clinical, and they're trying to figure out what's going on because he has leakage in the brain. It has something to do with the spinal fluid going down to the spinal column in the back, and then there are Tarloff, I guess they call it Tarloff cysts.
Yes.
That are along the spine.
Okay.
Now, I don't know. I mean, they did a couple of things. They did biopsy, and they tried to do one thing to see if they could stop the leak. And I just wondered if you would have any idea of what something like that may be, or if there'd be any kind of sane kind of treatment that could be done with that. Because right now he gets back pain, he gets headaches, and he gets and it's a concern of his because
my God,
doctors,
of course,
I
it's
don't
probably
think
terrifying. Yeah. Was there anything that started this syndrome that he has that you know of? Was he injected in his back or neck?
Yeah, he was injected. Yeah. Uh-huh.
Okay, so here's what may have happened. Sometimes if the dura, which is the coating around the spinal cord that holds the fluid in, is punctured, you can have what's called a spinal headache. All right? It's a leak.
So it's called a dura?
The dura is may have been punctured. Yeah, you can look this up on Google. I'm not saying this would happen, but if he had an injection, he didn't have this before the injection, this is most likely what happened.
Before the injection, it was they were trying to figure out what was going on, but they found out that he had, I guess, a leak that was going from the brain stem to.
Well, I don't know which happened, the cart before the horse or the horse before the cart.
Yeah.
But sometimes these can be healed with what's called a blood patch, where you just take some blood from the arm and you put it on the spot where there's a leakage if they can see it on an MRI. And that works very efficiently. He may have something else, which I don't want to get into on the show. It can be a Chiari malformation or something like that. And that's very complex.
Oh, yeah. But I just... I thought, because I've listened to you quite a bit, and
good.
Obviously you've been around for a long time, and I just thought,
I'm an old man.
Yeah.
Yesterday I was a young man, and then I woke up this morning. I looked in the mirror. I didn't know who it was. Anyway, there's
a couple got me by about 10 years, I guess. But I
Well, I'm warning you. We live a very long time in my family. When people hear my age, when people hear how old I am, they go, "Oh, you want to retire?" And I go, "Retire? My God, I plan on going at least another 25 years."
Well, good. Why stop there, right?
Yeah, and I just hired another doctor who does the work that I do, named Thomas Grove. He is amazing, and he's doing most of my injections for me now. I'm still there. I'm still holding hands. But it's nice to have some young blood there with me too. So hats off to you, Dr. Thomas Grove. I think you are a miracle worker. And anyway, back to your brother. He may have low back pain, which has nothing to do with this leakage in the spinal cord or the brain, and that's something that we could probably help using platelets or stem cells. I would have to touch the body, like I tell everybody. I got to touch it to know what's going on. And unfortunately, I get way too many people who come in after a failed surgery. That means they went in, they were told the surgery would do the job, and it didn't work. It made them worse. and I say, did the surgeon touch your body and examine you? And I rarely have ever had someone say they touched the body and examined them. Rarely.
Yeah.
They throw the MRI X-ray up and go, look, you need an MRI. You need a surgery. Well, that to me makes zero sense, because we already know that the images can't tell us if we're having pain or not.
I see. So right. And at this stage right now, he hasn't gotten any surgery. So, but there's these specialists floating around. One saying that, well, we think we know what it is, but we're not quite sure, and that's that's unsettling to get that, And then you got one person out of several that seems to know. Well, he's the best, but he doesn't 100%. That kind of thing.
Well, there are situations like that. I mean, doctors are not what we think they're supposed to be. We're just humans that have a lot of experience in a certain area. So let me ask this. You started off by saying your brother had low back pain. That was your what we call the initial or the chief complaint. And then you talked about these other things. So these other things may have nothing to do with his low back pain. Do you understand why I have to? No, that means not. That's not a problem. Plenty of people with Tarlov cysts have no pain.
The ones that accumulate around the spine, those Tarlov cysts.
It may not be the issue. See, this is what I call a red herring. You know what a red herring is? You have your hand out in front going, this is the problem, but you got your other hand in the back behind you hiding the real problem. So this may be a red herring. I have to examine him to know what's going on. I've got to use my hands, move him around, and see what it is. I may be able to help him in 2 minutes. I may never be able to help him, but I won't know until I touch him.
I see. And it is. Would there be? I know I probably. This goes into other things, but I mean, as far as him to be afford the treatment, is there different avenues he can take as far as?
I don't know. I got to touch. I got to touch the area first. I don't just touch someone and say you need treatment and then just inject them. That's their choice.
Oh, okay.
I don't ever tell anyone you have to do anything.
Oh, I got you. So would there be an estimate of what the what do you call the initial what do you call it when you go and you see what somebody's got?
Well, the best thing to do is call the office at 800-300-9300. You can handle the mechanics with them.
Get the initial cost for that.
Yeah, just call the office.
So that 300. What was that? I'm sorry.
800. 300, 9300.
9300.
Yeah, that's to the office, and there's people there right now.
Okay.
Yeah, also I suggest you send your brother to www.jointrehab.com. That's my website.
Jointrehab.com.
Yeah, and you can read about...
He's all the way in Oregon, so he could probably still get that.
Oh, yeah. It doesn't matter where he is. I have people come in from all over the world. So Oregon's a quick trip. Yeah. It's so funny. We have people that call in the radio sometimes from, let's say, Orange County, and they go, I'm too far. Well, how far is it worth going for a healing?
Dr. Darrow.
Yeah, so go to my website, www.jointrehab.com. Call the office, 800-300-9300. God bless you, Anita Valens and Alex and Suzette and the rest of the staff. And we love you, and we'll see you soon.
We will. I'm Anita Valens. Thanks for listening. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.